We're going to talk now about developing the indicators for measuring the impact and success of your allied health assistant model of care. This is divided into 3 different sessions, and the first one really is trying to unpack the idea of impact and success. The learning outcomes reflect exactly what we've just said. When we did our Queensland Allied Health Model of Care project with the 55 different models of care that we implemented in a range of different settings, we found that some teams struggled to identify key impact indicators. Instead, what these teams identified was indicators of success. They're 2 slightly different concepts, and we're going to explore them just briefly in this presentation. So firstly, the idea of success reflects the extent to which you have achieved what you set out to achieve. They tend to be broader goals. Impact, on the other hand, tends to be a little bit more specific and certainly should be reflected exactly in your key drivers. So here we've defined impact as that impact of the intervention on the desired goal or driver. We're going to go into this in a bit more detail. From the Models of Care project, we identified these indicators of success. As you can see, they are slightly more global than some of the impact indicators that you might want to see. In particular, if your driver is to see improved client outcomes, you can see here in success indicators, they're too broad to reflect that kind of level of detail. One of the key ones that people spoke about was that their implementation went as planned. This is something that you can celebrate certainly at the end of implementing an allied health assistant model of care, and it might be a core success indicator that you want to reflect on at the end of the process. Let's drill down now and look at some of the more specific impact indicators. In our research over the last 20 years, we've identified the way that allied health assistants impact on client outcomes, staff outcomes, and service and organisation level outcomes. We're going to talk about this now in the next few slides. We've talked about this a little bit briefly in one of our other modules, looking at some of the evidence behind the allied health assistant workforce. Here we've identified who the AHAs impact, and this then helps us to link slightly closer to our drivers. Remembering, of course, that a successful model of care is where the driver is close to outcomes. So we know that all of these features have been evidenced in the research. Allied health assistants are known to impact clients by their capacity to provide more and better client-centered care, and so on as we go down the list. Let's have a look in a little bit more detail how we know this information. First of all, I want to point out that most of the impact indicators that we saw on the other page, or the areas that we know that allied health assistants impact, are to do with the client. The client sees that they get better care and better outcomes. Through increased service capacity, we're able to see improved quality of care. Through lower staff turnover, we'll see a more consistent service. We'll see improved continuity of care, and ultimately we'll see the flexibility in the workforce to impact unmet client needs. So this diagram helps us to understand how allied health assistants can impact the client in these ways. As we've said before, one of the core drivers for introducing allied health assistants into the service should be closely linked to client needs. This shows us how that might look. I'm going to go into a little bit more detail here. Professor Nancaro and I did some research in the UK quite some time ago. We looked at 30 teams, multidisciplinary and interdisciplinary teams across the UK. They worked in social care, disability and health settings, and they employed a mix of professional and assistant staff. We followed over 2,000 patients and all of their outcomes and looked at how their outcomes were reflected by the types of workforce structures that they were delivered care within. The 2 major outcomes that we looked at were the TOMS outcomes and the EQ5D. Here's a brief description of what those 2 outcome measures look at. We chose the TOMS tool, or the Therapy Outcome Measure Scale, because it unpacked the 4 different dimensions that clients are looking to improve or to stay steady in when they enter into these community settings. The goals of care for those clients were around addressing impairment, activity, social participation, and well-being. So these were the fields that we measured for each and every patient client that went through these 30-odd services over a 3 to 6 month period. We also looked at the EQ5D, which is a client-completed quality of life measure. We were looking to see how the outcomes of care were impacted with different configurations of workforce models, those that had more assistant staff or less assistant staff. As far as we know, this is the first and only study that has looked at client-level outcomes. Most other studies look at the perception of client outcomes from a staff point of view. So on that note, what we found was that when care was delivered by a higher proportion of assistant staff and there was a greater intensity of care provided by assistant staff, this was associated with greater improvements in the client outcomes listed here. This, as you can imagine, is a bit of a big deal. But the key point here is that because of the input required to develop and support allied health assistant roles, we also found that it can be more expensive to use a high proportion of support staff. So you can see that we have mixed blessings here. Firstly, that we can see good outcomes for clients if we use a greater number of assistant staff in our team makeup, and when the care is provided by assistant staff. But there is a need to develop the assistant staff, and that comes at a cost. So being mindful that there is a tipping point where the cost of having assistants in the team may be outweighed by the amount of impact they can have on client outcomes. The key point here is that high quality client outcomes resulting from allied health assistant input can only be achieved through addressing the mechanisms and contexts that allow allied health assistants to deliver care effectively to clients. As we've seen, there's a complex number of mechanisms that influence how effective an allied health assistant to be. And as you know, the allied health assistant is only as good as the team that surrounds them and the organisation within which they are employed. So although allied health assistants can influence patient outcomes significantly because they can provide a higher intensity of care and also the type of care that they deliver, it comes down to the mix of all the other contexts and mechanisms that allow them to be able to have that impact on client outcomes. Because of this, the allied health assistant impact cannot be measured by one single indicator alone. There are multiple mechanisms and contexts that enable an allied health assistant to be impactful, and each of these needs to be defined and measured to enable a true reflection of what it is that's helping an allied health assistant to have impact or not. This diagram demonstrates how allied health assistants fit within the team and the organisation, and how all the different factors will go towards influencing those client outcomes that we've just listed. So in the first diagram that looked like this, we just saw allied health assistants and how they can potentially impact client outcomes. This diagram demonstrates, however, that allied health assistants can only deliver good therapy and a higher intensity of care to the client if these things are in place. If allied health professionals are delegating well, if they're involved in training and supervision, if there's a good skill mix of AHPs in the team, that there's a different number and type of allied health professionals in the team, and that the scope of practice of an allied health assistant is determined by the allied health professional, and that both work to their full scope of practice. In turn, AHPs and AHAs are influenced by the organisation within they are employed. And all of these things here we know influence the success of how well allied health professionals and allied health assistants can impact client outcomes. So a complex web of mechanisms contribute towards the AHA effectiveness at influencing client outcomes. And as you can see, it is not just the allied health assistants that contribute to improved client outcomes. It is allied health professionals and the organisation that they're employed within also. So in summary, we know that greater proportions of the care delivered by allied health assistants, which include things like repetitive rehabilitation, enablement, friendship, emotional support, motivation, advocacy, all these things lead to improved outcomes. However, it is the collective impact of the allied health professional input with clients, the allied health professional-led training, supervision, delegation, the supportive team, management and organisational environment that surrounds the AHA that allows for improved client outcomes to come about. In the next presentation, we will unpack all of these points and how they influence the staff within a multidisciplinary team or within a team that has allied health assistants.